Hi, I'm Carly Taylor, and I picked Mass Media and Human Communication, which is the use of mass media outlets to get information to the public. This includes television, newspapers, magazines, and social media. Pretty much any form of media that reaches a lot of people. I believe using mass media to communicate in the context of public health is super important, as it brings awareness to health issues that people might not otherwise come into contact with. It's also easier for health professionals to get messages to more people at once, as we could see with the COVID-19 pandemic. And with this, can make people advocate for certain health policies. People can share their experiences, and underrepresented communities can have a platform to advocate for better healthcare. It's also great for areas with limited resources or limited healthcare to know what is going on in the world and give them access to health services. Also, I believe that with the use of media, people are focusing more on their health as they can rely on messages from online rather than go to the doctor all the time, especially with the cost of healthcare. But this isn't always a good thing. With media playing such a huge role in people's lives, it makes complete sense that public health professionals would use media to get messages to the public. I've noticed that a challenge that comes from using mass media to consume information about health is to know whether the information is correct and reliable or not. On the other hand, healthcare professionals could be sharing completely reliable and factual information online, and people could have the idea that they aren't trustworthy because it's not in a professional face-to-face setting that people are used to, or because they've gotten information that wasn't factual from other forms of mass media, so they no longer trust it. A potential solution to this is that any person speaking on public health and using mass media to share information needs to be checked by whatever platform they are using before sharing anything about health first licenses and certifications. If someone decides that although they don't have any professional experience to share health tips for what could be millions of people to view, it could be extremely dangerous. TikTok and YouTube are extremely popular forms of media that people are constantly using to get different tips from, especially after the pandemic, as it's said that people have way shorter attention spans. And certain creators are taking advantage of people's desires to know more about health and have the easy access on media like this. I've noticed there are people who share the most ridiculous health information on both platforms. And it's obvious that the person just went out and bought a white coat and a stethoscope and placed it around their neck in a way to trick the viewer. They get money from the views, and their videos can even be put on the news or wrote about in magazines. While this can be obvious to an adult who's educated on how a doctor or public health professional would communicate with someone, and this isn't anywhere close, there are so many who aren't aware that they are in potential danger by listening to their opinions. I've noticed that many of these people advocate for dieting and exercise, which is of course a good thing, but then they'll show a product that they are selling or promoting that supposedly helps people lose weight, with no other information on what it actually is, what it does, or even if it is approved to be consumed. On the other hand, I have noticed that many public health professionals have taken to social media to get their factual opinions and passions on health out there. Dr. Mike is an actual doctor that has gotten very popular on YouTube and TikTok, that has been interviewed on news platforms, as he shares real information that isn't sugar-coated, the negatives and positives of mass media about health, even advocating for platforms to ensure actual professionals are sharing health information, and advocate for better health care all around and for people to take their health more seriously. He has brought together different doctors and nurses in different fields of medicine to share tips, warnings, and how a person can effectively go about their health. I feel like he does a great job at opening up the communication between doctors and patients. He answers questions and shares his own experiences on how he would go about treating something or someone. This gives people a trust with him, and they're more likely to take in what he's saying. He was interviewed a lot during the COVID-19 pandemic, and he even interviewed Dr. Fauci, as he advocates for the vaccine, for people to take care of each other, and kept updating for the public about the pandemic. He has shown that he is a reliable and effective communicator, so many takes what he says seriously, which is the ultimate goal when communicating via media about the health. The COVID-19 pandemic is the ultimate example of mass media being used for the public health. People looked to the media for answers. Media brought awareness to the public, easily shared any guidelines or updates to the people affected, including healthcare workers, and played a huge role in the vaccine being given, and shared how important it was that the vaccine was given to people. Mass media being used to communicate about health is of course going to have negatives, as people jump to share information they believe to be true, or just in the hopes that they get views. But with a focus on the health professionals doing it the right way, I think this could change. The use of media isn't going anywhere, but it's time to set clear restrictions to keep everyone involved safe. The positives of being able to share important health information immediately, to advocate for change in public health, or get a trust formed between health professionals and viewers, completely outweighs the negatives. Health communication in this day and age goes further than just being in a doctor's office, as people search for answers online or talk to the people around them for answers about their health, which is not always a good thing. There's an even bigger reason to acknowledge that it's better for the patient if communication through media is used, because the people with actual answers and safe information aren't taking advantage of our media-fueled world than other people are. Thank you so much, and I hope you understand how important it is that media is used for information about health.